Next up, I'm very happy to present Dr. Sean Kidd from the University of Toronto, as well as the Canadian, I always get it, Canadian Addictions and Mental Health Association. Is that right?
All good.
I
Yeah,
always call it
we can cover
CAMH.
it.
Okay. And Swelen Andari. And Swelen is the Director of Strategy, Climate Resilience, and Youth Mental Health at CAMH. So welcome.
Right.
Thanks so much for having us. I'm just going to share my screen so we can show our slides and go on presenter mode. Great. Can you see our presentation? Oh, great.
Yeah, looks like it's coming through.
All right. So we're just going to do simple introductions before getting started. Thank you so much for having us here. My name is Swelen Andari. I use she and they pronouns, and I'm calling from Toronto Treaty 13, which is the traditional treaty territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And I'm here with my colleague, Sean. I'll let you introduce yourself and take it over.
Great. Thanks. Yeah, good to be here. Sean Kidd, I'm a clinical psychologist by training, as a scientist in the Division Chief of Psychology here at CAMH, also calling in from Treaty 13 territory. And it's going to be a great chance here as well to speak to the Indigenous partnerships that really underlie our work and how our work hopefully is meeting our core aims around reconciliation. So great to be here. Okay, all right. So we certainly will be available if questions come up afterwards. This is just going to be a very short presentation about what at least feels, I think, to us to be a kind of a complex program of work that I think we struggle at times to wrap our own heads around. But just briefly, for those who don't know, CAMH, or the Center for Addiction and Mental Health, is Canada's largest academic health science center focused on mental health and addictions treatment. So it's got a very large set of outpatient services across age spans and conditions, large inpatient capacity, a large research and a large education agenda. So a lot going on all the time. And I think where this work came from is really, as we've moved along, and this is work that continues, is just really understanding the really profound and cross-cutting implications of the climate crisis for a place like CAMH. It goes far beyond, as I've learned over time, far beyond my earlier, more superficial understandings, and that's what we hope to walk through today. I think nothing could illustrate, the implications for a place like CAMH better than what happened in the 2021 heat dome, and the observation that the illness or the diagnosis, which represented by far the greatest mortality rate, was people with schizophrenia, for an array of reasons. And what happened out west during that incident, where people with schizophrenia died at roughly 3 times the rate of anyone else, and this includes chronic physical conditions too, is really of course, a number of conditions related to poverty, substandard housing, and so forth, and social isolation and aspects of the illness. But really importantly, that was a service system that wasn't ready. And I would say that we too are not ready. And I think this is representative across the country and in many ways around the world, is that the level of preparedness isn't where it should be. And this is just one small example, really, of one severe mental illness. So that's just a bit of context. Now, when I mentioned, the multifaceted implications, of course, and with this audience and this group, certainly don't need to spend too much time on the obvious implications for the mental health and well-being of young people. The climate crisis is a driver of disparities and intersections of mental health challenges and identity, where things get worse and threats are multiplied. There's emergency response. In the area of mental health, of course, there's brain development as well, implications there. There's staff burnout and retention. There's our responsibility on the public end. So CAMH does have a responsibility for educating the public, meeting the needs of the public. So there's an education element. There's an element for our learners. And I could kind of go on and on, set of policy implications. It's really complex and extensive. And that's where we're hoping to do is give a little bit of a sketch of here today of our journey to date. We've certainly not arrived, but our journey to date in trying to figure out an organized response based out of CAMH and for perhaps relevant to places like CAMH.
Great, thank you, Sean. So yeah, we're going to start by actually just depicting the journey that we've gone through so far in building a climate crisis response. And so what you see here is a timeline of this journey. And it starts in 2019, where a few staff at CAMH, myself included, we formed a climate action team. And at the time, we advocated with the union and with CAMH leadership to actually support the global climate strikes that were happening back in 2019, as well as, we began to meet with our facilities team to advocate for better waste management and signage and practices. But really, what was really exciting is that we gained a lot of support and visibility and understanding of who at this institution cared a lot about climate. And although the pandemic stalled our efforts, we ended up still meeting. And through those meetings and in strategizing, we decided that we wanted to redirect our efforts to gain leadership buy-in and institutional ownership over this issue because we felt that that would be the way in which we would go farther. And so in 2021, CAMH released its Truth and Reconciliation Action Plan. And although this was done independently from climate justice efforts, we wanted to highlight this because the strong connection between climate change and colonialism really speaks to the importance of our commitment to truth and reconciliation as we develop climate justice and climate actions. And so it really goes the other way around. We believe that our truth and reconciliation efforts can reinforce our climate justice journey. And so between 2021 and 2023, we began to see, similar to what I depicted earlier, a lot of more initiative being taken by CAMH staff by actually integrating a climate lens and climate action into their actual professional endeavors, including Sean and I. But to give you an example, our colleagues who administer the Ontario Student Drug Use and Health Survey, or the USDA survey, this is basically the longest running survey in Canada, and it's been run for the past 30 plus years by CAMH with Ontario students grades 7 to 12 to understand their substance use, their mental health and physical health trends. And they included for the first time, and now they've continued to include questions about the impacts of climate change on their mental health, which is allowing us to understand how young people are doing. But also for me, I had been involved in climate justice efforts for over 6 years outside of my work at CAMH, and I was organizing with Common Horizon and 350 Canada, Climate Justice Toronto, and I burnt out through that work and I had to give it up. And so by taking time to heal and recover, I ended up actually thinking there are ways of integrating this work into what I already do in systems transformation for the mental health system here in Canada. And so I ended up developing a proposal for a portfolio, and now I hold the first role that is 100% dedicated to building climate resilience for young people experiencing the psychosocial impacts of climate change. And I'll pass it over to Sean to continue on with the journey.
Sure. Yeah, thanks, Swelen. And maybe I'll just briefly share my own story because I think I'm somewhat similar to a number of people at CAMH. So I'm a scientist. Most of my research has been in the area of youth homelessness and trialing interventions for people with severe mental health challenges. And I picked this area up out of frustration with lackluster reactionary responses, such as giving out water bottles and cooling and warming centers, and seeing the impacts and the folks that I work with. And so, I started to do some research in this area and the research journey, and I'll share a link to the work I've done in the area of poverty, climate, and health internationally and then in Canada, has been one of just kind of, unfortunately, getting more and more disturbed by the depths and complexities of impacts of the unequal impacts of the climate crisis for people experiencing poverty. And so that brought me into this area and having a division leadership role at CAMH. So at CAMH, like a lot of organizations, there are many priorities, many agendas happening at any one time, and everyone's work is urgent, as we all know. So it can get hard to sort of center something and really get buy-in and investment. So we were fortunate, however, where Swelen and I, we've engaged leadership in many conversations, found people emerging in this area, people who've been at it a bit longer, and we pulled together basically a bit of a pitch for our executive leadership team at the hospital. And the great discovery that we had just about a year and a half ago is it wasn't a hard sell. We did not, we laid out the implications of the climate crisis for CAMH, potential avenues for response, and there was a lot of nodding heads and even some surprises, like our vice president of HR spoke about how the values we're reflecting here reflect the values of staff, and this will help staff feel more engaged and maybe be more likely to stay at CAMH. So that really, with a place like CAMH, and many of you might be aware already, but if you can move towards ELT or executive leadership engagement, at the time as well, a new strategic plan was coming together. We were able to get climate response in a fairly action-oriented way in the strategic plan. And then CAMH is then needs to respond to the board of directors of the hospital. So you begin to sort of set up a set of accountabilities and governance implications and other pieces that really begins to weld response in. So it has to be more than a website or more than some small efforts. It really needs to be kind of woven into all activities. And so that really kicked off a lot of work. We've started retreats. We're working arm in arm with collaborators at Shkaba-Makwa, which is kind of the home base for all of the Indigenous programming out of CAMH. And we've been holding a number of retreats to work towards refining our values, setting aims and objectives, and figuring out resource planning, governance, all these pieces. But I'll pass it on to Swelen to take it from there.
Yeah, so one of the first things we did actually, as we gathered our colleagues, was to develop this set of guiding principles. And you can see, we see them as living principles, so they will continue to evolve, but this is the current list that we have here on the slide. And really, we wanted to do this because we wanted these principles to guide our choices and our decisions. And one thing we're exploring is potentially integrating a principle-focused evaluation framework so we can actually understand how are these principles being used, how are they informing the work that we do, and really what they might result into. But to give you an example of these principles in practice, when we hosted our first climate action retreat at CAMH, we actually took these principles and there were initial sketch that we refined with our colleagues, but in practice, we hosted our retreats outdoors at the CAMH ceremony grounds because we wanted to ground this work in a physical place that also held meaning in our vision for honoring all our relations and our commitments to truth and reconciliation. Our CAMH elder, Diane Lombode, co-designed the retreat with us, and she did a teaching on all-around seeing and the two-eyed seeing approach to actually build ways in which we can integrate Indigenous knowledge alongside scientific knowledge as we pursue collective viable action for addressing the impacts that the climate crisis has on mental health. But we also held space for people to share their stories, their emotional connections to the land, to the places that they love, and how they hope to protect them. So all of that really allowed us to build trustworthy and authentic relationships with each other, and that's led us to build a strategy and this vision that Sean will speak about briefly. And the last thing I'll say is that for us, it's been really important, but also challenging to realize is that the way we do this work, our processes, our values, and the cultures that we build through climate action at an organizational level matters as much as the actual outcomes that we're seeking. Because at the heart of this work, we actually need to shift the way that we are relating to one another and to the earth. So I'll move on here to the next slide.
Okay, so I won't read all the way through this, but you can see here what is our current kind of working vision statement. And really it speaks to, centering partnerships and collaboration. And of course, the mandate of CAMH, which includes clinical care for the many thousands of people that come to us for service, our responsibilities in terms of population health, engaging government, generating knowledge, research, and then as well, education. So we kind of have three buckets in terms of our objectives, and maybe I'll let Swelen, you can speak to objective number one.
So yeah, under, addressing the mental health impacts of climate change on CAMH patients, our team has received a CHR grant to conduct a community-based research project in which we're actually supporting the adaptation of the work that reconnects by Joanna Macy and Chris Johnstone to basically develop an active hope intervention with and for youth, particularly. And we're hoping that the findings of this work will lead us to actually be able to test it and implement it, support our patients. But also, we're beginning to work with our clinicians, our child and youth clinicians, to map a clinical guidance process to support children and youth patients who come to CAMH with climate-related distress.
Yeah, and as you might imagine here, this is sort of like starting with the so-called low-hanging fruit is work that's already kind of has some legs under it. We are engaged with the CAMH Foundation and looking at operational funds to kind of ultimately have a backbone because this cannot be side of the desk work, of course. Subjective number two is the population health piece. I guess an example I could provide from my own work. I dropped in the chat there, our website, which is still under development, but it's coming along. That shows our global work on homelessness, climate, and health, and then the national work on climate, poverty, and health. And basically, this is mostly a knowledge mobilization crew so far. It's experts across the country, many different forms of collaborations and engaging lived experts. And we're addressing a few things. One is the really pronounced knowledge gaps related to poverty, climate, and health. There's a very general understanding about the threat multiplier piece, but if you scratch the surface a bit, we just really don't know what's going on for whom and when and how, and how to understand what to do. So gathering information, experts of different frames coming together and engaging and building relationships with different levels and departments within governments to ultimately hopefully begin to sway things like more inclusive adaptation plans, and assessments, and looking at how investments need to happen, how we understand what impact is, but really trying to do some systems level work. That's an example. And then the extreme weather emergencies, we piloted extreme heat guidance last summer. But we're continuing to iterate on that, working with Dr. Glenn Kenny out of the University of Ottawa as an expert in heat physiology and looking at points of collaboration with other hospitals, essentially to sort of across all areas, clinical workflows, emergency response planning, just general clinical care, alerts, outreach, how we can prevent the terrible things happening like what happened in BC in 2021, where a heat wave caused such a loss of life. So I think that's kind of more or less our presentation. I know it was kind of quick. I'd say next steps for us are to continue to consolidate this work, consolidate the resourcing plan. Our governance, essentially, we're going to be reporting to the whole ELT. The climate crisis is such a broad issue for CAMH. It's not like one executive leader representative would be our person we'd report to. So report to all the exec of CAMH. And just continuing to build capacity. There are many people like myself who are in early days or different stages of interest that need to kind of get upskilled. But I can say that there's a lot of investment and energy in this area. I've been working in hospitals for quite a long time, and I've had many efforts that really feel like you're trying to push a rope. And this is definitely one of them. There's just a lot of energy and interest in this, and people basically asking, how can I help? But I'll see, Swelen, if you have any last words before we stop and answer some questions.
No, I think you covered all of it for now, Sean. I guess I'll just say that it's really been inspiring to see how like real change can happen when a group of concerned people come together. And in hierarchical organizations, one might think that a lot of change always needs to come from the top, but actually we've proved that if there's like critical mass and a lot of people who actually care about something, a lot of change can still occur. So I encourage whoever's here from different organizations to continue to advocate for integrating this work into your strategies.
Great. Thanks very much, Sean and Swellen, for that great presentation. It's so nice to hear a story about when you bring an issue to your executive leadership team. They say, "Great, okay, what can we do?" If I just hope that we can all have those same experiences, and also highlights that change can only happen when you let people know, when you bring awareness. So, yeah, thanks very much for all your work. Let's see if we have any questions here. I saw one in the chat. Okay, this is from Shelley. I live in Toronto and congrats for this great work at CAMH. Ever thought of organizing or planting a Miyawaki forest, pollinator forest, little forest, pocket forest for the staff to come together? And also one of the doable things we can all do to mitigate and reverse the planet heating up. I planted one with community and it is life transformative.
That's amazing. What a beautiful idea. And thank you so much for sharing it. We do have a garden that we and, through collaborations with other organizations, we're able, like, it's not a pollinator garden, I don't think, and it's not a like in sorry, like following, it's not really like a forest, as you're saying, but we would love to bring these ideas forward to our colleagues and perhaps we can make them happen. Thanks for the inspiration.
Yeah, definitely there's a lot of interest in prescribing nature, and we'll think through with our partners at Chicago Macquarie, like how that could happen ultimately, particularly for youth, older adults, people struggling with dementia. Um, Definitely a lot of opportunities and a need to grow there.
Fantastic. Thanks so much for sharing your work and your stories with us. Much appreciated. Um, and best of luck in the future. We look forward to hearing more.
Thanks so much.